Goal setting with clients. When you begin your course, you may feel overwhelmed by the number of things to learn. Goal setting is one technique you can use to help focus your energies and concentrate your efforts in order to prioritise your learning, build confidence, particularly as you chalk up your achievements when you can see yourself physically moving towards your target, and plan ahead so that you can manage your time more effectively. The book that accompanies this website looks at how to develop goals and build action plans in order to maximise your chances of success. The skills you use for goal setting in the classroom are very similar to those you will need to use when working with clients or patients in the formulation of care plans or in developing treatment goals. This 2-minute tutorial looks at how to transfer the skills you've been using to set goals for yourself to working with clients. Being able to set goals within treatment interventions is a key skill in practice. It's important for a number of reasons. It provides a focus for the approach or treatment you are providing and ensures that everybody is working to the same end. Goals offer an overarching framework which facilitate planning and help in the identification of potential resources. When created in partnership with clients or patients, they promote self-efficacy, enabling people to be actively involved in identifying their priorities, and as a result can increase motivation and build confidence as they are able to measure their progress. Health and social care practice is increasingly outcome driven. That is, you need to be able to determine and demonstrate whether or not your interventions have been effective, both in terms of your own practice but also in justifying your use of resources to a wider establishment or organisation. There are a number of ways of setting goals. Most of these methods involve 3 elements: who the goal relates to, what's going to be achieved, when is it going to be achieved by. An example of this would be client X will independently make a hot cup of tea by next Wednesday. Note, who does the goal relate to? Client X. What will they do? They'll make a cup of tea. By when? By next Wednesday. And in reality would include a date here. To be even more accurate, you could also include a specific condition. How will they make a cup of tea? Independently. Remember, the more precise you can be, the better it is. For clinicians working within a rehabilitation setting, there are additional structures to setting writing goals that you could follow. For example, Sherry Bosching's FEAST method includes a number of additional elements. This looks at functional gain, what's the overall purpose of the intervention, expectation, so the client will, action, do what, specific conditions, under what condition, for example with verbal prompts, with a physical prompt, independently, and finally the timeline, by when. So let's see if you can put this into practice. Read the following problems identified by clients and see if you can write simple goals to meet their needs. So let's start with a person with a minor hand injury who would like to clean their own teeth, Mr. Y. A person with memory problems who would like to cook for themselves, Mrs. X. A person who is experiencing weakness in their leg and who would like to be able to walk short distances, Mr. C. And a person who is unable to interact socially, Mrs. W. Okay, hopefully you've had a little chance to think about that. Here are some examples of possible goals. So, for Mr. Y, it could be for Mr. Y to independently clean his teeth twice a day using an adapted toothbrush by Friday the 23rd of June. For Mrs. X, by Saturday the 6th of May, Mrs. X will prepare a light meal with verbal prompts given by the carer. For Mr. C, in 2 weeks' time, client C will be able to walk 500 yards using his walking stick. Study Skills for Health and Social Care Students, published by SAGE, describes differences between short-term, medium and long-term goals. Let's take Mrs. W as an example to look at how this might look in practice. So, for Mrs. W, a short-term goal might be that in 2 weeks' time, Mrs. W will make one telephone call to her friend, Mrs. Y, to engage in a 5-minute discussion. A mid-term goal could be in 1 month's time, Mrs. W will visit her friend with the support of her carer. And a more long-term goal might be that in 6 months' time, Mrs. W will have independently met with for a minimum of 4 times with a named friend for lunch. Now it's your turn. I'd like you to revisit the previous examples and write possible short-term, mid-term and long-term goals. Remember, the secret to successful goal setting is practice, practice, practice. Good luck.